I have seen patients' lives be transformed just because they have the right amount of social support. It can be pretty dramatic because, you have like these really high intensive, severe behaviors turn into like a night and day difference just because of the right environment.
Welcome to Healthcare Liberty Labs with Tiffany Ryder, where we teach you what they don't want you to know about healthcare.
We all want to imagine ourselves as like when we die, we're just kind of like, we'll just die in our sleep, or
yeah, I mean, that's what I want. I think so. Most of us want it.
Yeah. But the reality is, just what it is in 2025 and beyond is that aging is a very long and decline is a very long thing. So thinking kind of proactively about it now is, I think, really important. And so this is just going to be like, I don't know, maybe sound like your traditional, like 1 ounce of prevention is better than a pound of cure kind of answer. But I really think that we need to be investing more in our organic social supports. And and that's kind of like the high level clinical term, but really what it would mean to you or I is just like having our, checking in on our friends, family, and our neighbors, our people, and having, our own kind of community supports. Because again, I've worked from the the elite suburbs of Philadelphia to like a largely homeless population, and I'll tell you that the outcomes, and this is just like from, my personal perspective, but like, if you have an organic community, that can make up for having to buy one later on in life.
It doesn't have to be family that provides that, right? It can be friends. It can be community organizations, or a card game that you are attending once a week to start those 200 hours to like get that clock going. But I think it's certainly an important consideration that we don't even talk about because we like to medicalize things.
Definitely. Yeah. I think that, I think part of the big piece of our work here in the social determinants of health space is normalizing discussions of social determinants of health, because we tend to think about them as happening to other people, or that high level clinical term. And as, in the pedestrian world, we would call that lifestyle. We would call that, loneliness or non. We would
it's
call
a horrible
that
term. Social determinants of health is a horrible term. I know exactly what it means because it's my job to know, right? But you tell like my grandmother that we're concerned and we need to do a questionnaire on the social determinants of health, and she would be like, "What? Like, go. Just get out of here." Like, what are you talking about? And I think that, that's it's part of the problem. It speaks to the problem, because I think in public health where we are right now, we're so full of ourselves and we're so full of what we know and how we look on, CNN or Fox, like, instead of worrying about, look, your patients don't care about all that. They don't understand what you're saying. What is the language? What is the message that we need to get across to real humans who are out doing their lives trying to, live a fulfilled life? How do we reach those people?
And, part of like what you mentioned about COVID, is the other thing that happened with COVID is that economic downturn, and people, there's more pressure placed on working class and on everybody, but people are working longer hours. A lot of people moved, so it sort of disintegrated and fragmented some of those organic communities that we, would have otherwise like naturally have. Like, we don't really have the third space anymore where, we can kind of like, where that's not work and not home, but just like socialize with other people.
I guess I'm curious from a social work perspective, how you view that shift, right? How you view that shift from patients being hospitalized to they're living in the community, but is there a lag in mental health resources and these like social resources that people find that they need, and we're catching up to that? Or was there just no plan and we said let's shut down these inpatient centers for, substance abuse, rehabilitation, all of these things, and just let people go be with their families, but then no one checked to make sure that there was a family? Like, how do you view that situation? Because that, in from my view at least, is a big piece of the problem. A big piece of the problem is that we quit handling things this way because we decided that we didn't like that, and maybe it really was bad. I think in some cases it certainly was, definitively. But also we sort of, they say, like, put lipstick on a pig. Like, we sort of like just pretended that this other solution was only good, and clearly that's not the case. Clearly that's not the case, as evidenced by the teenagers that I see with suicidal ideation in the emergency department, or the elderly people who come in and they say they just wanted to die because they couldn't afford to pay their electricity bill and they didn't have heat anymore, right? Like, we're missing some things.
There's a huge need for just better training and a stronger workforce when it comes to social workers, when it comes to, anybody that's working in mental health. We put a lot of pressure on this role, and so it's really easy to get inundated and burned out, and also it's really easy to be sort of inclined to just hire whoever's willing. Also because the salaries just aren't what they should be. So you really miss out on the quality, because the frustrating thing is that when you have a vulnerable population, a vulnerable patient, and it doesn't matter, like, whether it's mental health or something else, when they go into these programs or do these outpatient types of treatment, and they don't have a good experience, or it's not effective, or they don't feel valued, or for whatever reason, if it doesn't go well, the conversation isn't, let me try somewhere else. The conversation is, mental health doesn't work for me, or drug programs don't work for me. So they abandon it completely. And so I think that just speaks more to the point of needing to better fund social care proactively, so that way we're avoiding those missed opportunities.
This episode brought to you by CrowdHealth. CrowdHealth helps you find awesome doctors, negotiate your bills, and fund those bills through our peer-to-peer funding platform. For less. Welcome to an easier way to pay for healthcare.
Yeah, I mean, I'm realizing how biased I am on this subject as I'm having the conversation with you, like right now in real time. But it's very similar to the whole question of primary care. I remember when Obamacare, the ACA, was passed, and there was a lot of friction around, is healthcare a right? Should everyone have the right to basically the labor of other humans, right? Of clinicians and people who are providing these services, which is, I think, is a valid question. But my response from then until now has always been, well, really, we're paying for it anyway. And my response is that now, right? Like, in this moment, we're having this conversation about funding more community support or social work, or funding these programs where someone can go in and administer maybe a long-term antipsychotic every 2 weeks to someone who needs that to remain mentally sound and go to work and raise their kids and do all the things that they need to do. And maybe this is just a piece of that for them. And to any criticism that I to anyone who comes back and says, well, why should we be funding that? Why should that be something that we're investing in? Like, my answer is always, well, we're going to pay for it when they go to the emergency room. Like, this is what's happening, except now this mother or this father is away from their kids. They've been psychotic or suicidally depressed, or whatever it is, for the weeks or days leading up to this episode. And they now require a 3 day to week long admission. And now it's a $50,000 problem. We could have hired a whole a whole person to just go do this task for them. So I think it really is a question of just being honest about where the resources are going, what is the money being allocated to, and how could that money be better spent. And I just can't say enough about primary care and how it is underfunded. And primary care doctors, if we want more primary care doctors, they should make more money. We should reimburse at higher rates. It should be a more fulfilling and financially feasible specialty to go into. And I feel the exact same way about social work and mental health and all of these other programs. And again, it's not because I hate money and I just want to set $100 bills on fire. It's because I like money. I like for people to be prosperous and contribute to our society. I like for taxpayers to have their money spent in the most, I don't know, in the smartest way, right? I want us to be good stewards of that money. And it seems like prevention by way of providing people with help that they actually need, that keeps them out of emergency care where they can then get taken advantage of by literally everyone, is the way to go.
I could not agree with you more. And I think we're definitely on the same page here because, I also get, a lot of those questions from my audience just from the different perspective of it. But, I'm not here to talk about how things should be or, the perfect world. We don't live in that world.
Yeah.
We're
You
here
literally don't have to make a decision on what's right or wrong or what. Like, this is the world we live in. This is what it looks like. And this is how it could look better.
But I did want to add a caveat to that because by no means, first of all, am I advocating for anything new? So the traditional healthcare system has partnered with social care organizations and programs since like the dawn of modern medicine. Back in the day, we called them almshouses. We called it respite care. We called it a lot of other things than we do now. So that's just always been a part of how society kind of constructs, the relationship between the medical system and social good. The other part of that is I'm also not suggesting that, we just kind of blindly, haphazardly, like throw money at, every kind of social program. I'm really, the more that, if you've been on my platform, if you've paid attention, if you've, been with me the last about 8 months or so, when I started leaning into this more heavily, it's about being strategic. Not every program or kinds of support makes sense for everyone at any time, at every time. It needs to make sense for the specific population that you work with, the specific community, and solve specific pain points that are commonly felt. It's one thing if it's just happened to like one patient, in a special circumstance or whatever. It's another thing if you keep seeing the same problem over and over again. So you think about it in the same way as like, every other industry. balances the need for individual responsibility and engagement with, customer support. Airlines, if enough flights are missed, they will change their app. They will change, seating structures
Yes.
or whatever. But, the healthcare system is the only industry where we say like, well, they should, where it becomes like this moral kind of argument. And again, you and I don't live in the world of morality. We don't have that luxury. We talk about, what is and what's not.
I'm a big advocate for people at all levels with all, variations of numbers behind or letters behind their name to be involved. We need nurses saying, hey, here's what the situation looks like from my perspective. We need social workers saying, here's what it looks like from my perspective. We need doctors saying, here's what it looks like from my perspective. But I think getting this multidisciplinary, multi-career look at the problem and then coming up with solutions that actually address what's happening in reality, not what just meets our moral code, would really take us far as a society. And, we're in the process of spending trillions of dollars that we don't have. We're in the process of going bankrupt as a country. Wouldn't it be nice if we could take better care of patients while doing the fiscally responsible thing at the same time? And I think there's an opportunity there. And I do think it has a lot to do with the people in your neck of the woods, the social workers, these people who are blending hospital and community.
Could not agree more. That's definitely a mic drop. But I have worked with dementia patients, and I bring this up because they're all, always kind of notorious for being those primary patients that tend to be dumped onto the emergency room at midnight because they have, a UTI or whatever. And so I will tell you, I have seen patients' lives and their families' lives be transformed just because they had the right amount of social support, because they had the right environment, because they had the right caregiver support, the right education. And so, these are, it can be pretty dramatic because, you have like these really high intensive, severe behaviors turn into like just a night and day difference, just because of the right environment, not because of medicine, not to like disparage, obviously, but like, but because they needed the right kinds of support in place, and we don't kind of factor that in enough. I just said the other day, the World Health Organization has said that 80% of our medical outcomes are dependent on social determinants of health, and yet our funding, the way that we fund healthcare, is less than 10% goes to social care programs. So we're kind of, funding in reverse. It doesn't make sense. The numbers, the math isn't mathing.
Yeah. And I hope as we move towards a more evidence-based approach in a lot of different areas, that this is one of the areas that will be addressed. So one of the things that I really like to focus on in this podcast is, we can have conversations about what we hope to see happen in the world, what we hope people will pay attention to, what we are advocating for. But meanwhile, right, people are at home and they don't know what to do all the time. What do you say to a patient who, maybe has like an aging parent, who is the mother of a severely autistic child who may need supports? What are the first community resources, or, how do they even begin to reach out and start finding help?
So the first thing that I would do if I was a caregiver of somebody with autism, or if it was somebody I loved, it's community first. So I would look for other individuals who were kind of in the same circumstances I am, whether or not it was, an organic community, like something that's like at a community center or online. That's the first thing that I would do. I would also look up, obviously, like state and community organizations that could help me as well. I would also, just depending on what condition it is, I would look at to see if I was eligible for any like state funded programs. That's where I would start.
I mean, that's a pretty good list. And it's something that I think you don't always think about, but is certainly available. One of the things that I found that local and state health departments and health agencies do a decent job of is providing resources that it almost seems like they try to hide them sometimes. I mean, they don't. I'm being sarcastic, but like it's like so hard to sort through, all of the technical jargon that's on the website or whatever. But I think this idea of looking for, I don't have Facebook, but a Facebook group with people who are taking care of their aging parents, right? Could be a good place to start. And then asking those people who are in your area, well, does the county offer any services like this? Does the state offer any services? Going to your county health department and saying, hey, I'm not asking for anything, but is there some sort of resource? Are there questions that I should be asking that I don't even know to ask? But getting those conversations started. And then the only thing I would add to the list that you gave that I think is great is making sure that you have an established partnership with a primary care doc. And, a lot of times, even if your primary care is not really where you need to be, they need to know what you're struggling with, what's going on. And they generally have a good pulse on the community and sort of what's around because they talk to a lot of people all day.
That's a really good. That's a really good point. Amazing. Yeah, and I think like also what you were saying about the jargon, that's another thing I think is kind of left sometimes not sometimes missed, is that we don't pay enough attention to the jargon.
Yeah.
So I know, like, as clinician, like if you have a caseload of like, so many, you kind of listen for certain things, and if the patient in front of you or their family member isn't listing those exact things, a lot of things it can be missed. So I think that would be my other recommendation, is just getting really clear on the kind of language, the terminology, and also like how severe or how bad things, like the stages, because you might be describing a different stage and you might not know it, and that can kind of like preemptively disqualify you for things that you otherwise would have, that your person otherwise would have been eligible for, because you didn't portray it in, kind of the exact format that you're supposed to. It's a horrible burden, but it's just true. If I'm just completely honest, is like the more accurate that you can talk about the picture of your person at a certain time, the more able you are to advocate for them.
And do you recommend people seek out, if they're having trouble, seek out something like a patient advocate, or, what do you see that helps in that regard, get those conversations going and get them headed in the right direction?
Oh, definitely. I mean, always ask for a social worker.
Okay. Okay.
If not available, there's always like community health workers. They also call them like navigators.
Okay.
Even care coordinators to some degree can also be helpful.
Yeah. Well, and then tell us where people can find you if they want to follow you. I mean, I've been so encouraged by your stories that you've shared about different, patients that you've worked with and solutions that are available. And I think that, people might be interested in that if they're dealing with some of these difficult situations we've discussed.
Well, thank you for that. I'm primarily on LinkedIn. My name's Christina Rodriguez, and what else? And I also have a podcast called Outcomes.
Okay. And if I'm a business or a family member of a patient, is there some way for me to hire you? And like, do you do consulting or anything like that for organizations?
Yes, I help organizations that are struggling to quantify social care and sort of make the business case for social care, care coordination, and things of that nature. Put that together. So, um, my website is also listed on my LinkedIn account.
Okay. Well, we can put all of that in the show notes, but thank you so much for coming to chat with us and just talk through some of the considerations that are going on in this whole community setting social work world.
Definitely. It was so fun. Thank you for having me.
Awesome. Thanks, Christina.
This has been the Healthcare Liberty Lab. Thank you to our listeners and our sponsor, CrowdHealth, for making this possible. Be sure to subscribe wherever you listen to your podcast, be it Substack, YouTube, Spotify, Apple, or somewhere else. We're glad to have you with us on this mission to rethink healthcare together.